All right. Good morning, everyone, and welcome to our Facebook Live on Medicare Advantage and open enrollment, which is going on right now. My name is Mike Berto. I'm the healthcare economist and exchange coordinator for Blue Cross and Blue Shield of Louisiana. Thrilled to be with you here today. And joining me, our resident expert on Medicare Advantage, Miss Ann Booth. Good morning, Ann.
Good morning, Mike. How are you?
I'm doing great. Excited to be here.
Yes. So I'm Ann Booth. I'm the manager of our Medicare plan, and I'm happy to be here as well to review with everyone their Medicare options. And I want to thank you for joining us today. If you have any questions, please drop them in the comments, and we'll be glad to answer as they come up. Or if you're watching the live stream later, we'll be glad to respond to those comments as well.
Yeah, we are right in the middle of an annual open enrollment period, which started on October 15th and ends on December 7th, with this year, I believe, is a Monday. Isn't that right, Ann?
That
Yeah.
is correct.
And what we're going to do today is we're going to talk about the kind of choices you would have for your Medicare plans going forward, and to kind of illustrate the differences between Medicare Advantage or a Medicare Supplement or original Medicare that you would get directly from the government. And they could be very different, very different. We want to talk about some of the benefits that you can get in Medicare Advantage that aren't necessarily present in some of the other areas that you might enjoy looking at. Also, we want to make sure that before you make a decision, you have a clear vision of what we call the 3 Ps, and stand by. We're going to talk about that in more detail as well. But there are critical and important things you want to consider before committing to a Medicare plan one way or the other. The other thing that's kind of risen its ugly head over the last month is fraud. And there are people out there, not so nice people, not so friendly people, who are going to try to trick you into giving them information that you really don't want to give out. We're going to talk a little bit about how to recognize fraud as well.
That's right. So, there's still time to get help and have questions answered. So, you all can call us today at 833-219-7435, or you can visit us online at Medicare Options 2021.com, and you can come visit us and sign up for some great reference materials and connect to have your questions answered. And it should be on the screen for you as well. And the deadline is less than a month away. So it's on Monday, December 7th. That's our annual enrollment period is going to end. So for anyone that is on Medicare, you still have time to enroll and to make your coverage changes, but it's not much time. So you need to get that call in because the holidays are coming up. You're going to get busy. So you want to give us a call. So I know everybody is anxious to learn about the difference between OMO. What is that? What's MA and what is MS? So we're going to talk about those things, Mike, today to get people to understand what is that and what does it mean. So we're going to talk about that. Yeah. So.
That's excellent. Why don't we start with something straightforward? What is original Medicare, OMO? What does that cover?
Okay, so original Medicare does not cover all of your healthcare expenses. So kind of like, I love Disney. I worked there when I was in college, and it's like Buzz Lightyear to infinity and beyond. So it covers only about 80% of your medical and hospital expenses. So that can get very expensive. You're responsible for paying the other 20%. So can you imagine if you have surgery or a procedure? I don't think I could afford that, or my parents, like they're probably watching, my mom, my dad, my stepmom, and I mean, I can't imagine them having to pay that bill if they did not have a plan. And it also doesn't cover your prescription drug coverage as well. So that can get really expensive. So think about that if you only have original Medicare coverage. That's the OMO.
Yeah, so it sounds like that original Medicare isn't like my employer plan. Like if I'm still working and I'm under 65 and I have an employer plan, they give me a number every year and they say, look, once you spend this much money, your plan covers 100% above that number if you stay in network and do what you're supposed to do. It sounds like what you're saying is that original Medicare doesn't have that number, doesn't have that cap that we would look for.
That's exactly, you are correct. That's right. Yes, that's
Okay,
right.
well, let's shift gears a little bit and talk about a Medicare supplement. Can you tell us a little about that?
Sure. So Medicare supplement plans supplement expenses that Medicare doesn't pay. And they also, some people think of them as Medigap plans that typically gives you the freedom to choose your doctor and have statewide network coverage. So a lot of people, if they travel a lot, they might have family out of state, they want to go travel 6 months out of the year, those kind of things. And Medicare supplement plans also work with original Medicare to help with cost of co-payments, co-insurance, and deductibles. Medicare supplements do not include Part D prescription drug coverage. So you'd have to have a standalone Part D plans that can be purchased separately for this coverage.
So to be clear, if I buy a Medicare supplement, I've got to first be on original Medicare, and then the supplement is a private insurance plan that wraps around Medicare and covers the things that Medicare left out, like we talked about before.
Correct. That's
Okay,
exactly right. Yes.
great. Just want to make sure I know what we're talking about because, this can be confusing for folks and there's so much material. I want to make sure that we're clear.
That's right. You got it.
All right. So we came on today specifically to talk a lot about Medicare Advantage and talk
Mhm.
about its benefits. Can you have Medicare Advantage and a supplement at the same time?
No, you cannot have both. You can have one or the other. So, and you would want to have one or the other, and we're going to explain that a little bit further.
Okay,
Yes.
great.
Yeah.
Now, from my reading, I understand that I become eligible to enroll in Medicare 3 months before my 65th birthday, and then the month of my 65th birthday, right? And then 3 months after that. So is that correct? Is my window 7 months long?
Yes, it is. And also people that, are on disability, so they can also be eligible for that. Now, if you miss the initial enrollment penalty, you could end up with a higher premium for life. So you want to make sure you don't miss that enrollment period time. Yes.
So
Um,
if I miss the 7 months, if I
that's right.
enroll 4 months after my 65th birthday, I'll be penalized for that. Is that correct?
Yes, that could be a late enrollment penalty. That is correct. Yes. So, you want to make sure you stay in that 7 month window. Yes, that's
Okay,
correct.
great.
So, and like I touched on about, the disability, you may have a little bit more information about that we can talk about too. So,
Okay.
yes. Yeah,
So people with what would be considered sort of a permanent disability might be eligible for Medicare before they turn 65.
that's right.
Okay.
Yes.
Well, that's a
Yeah.
conversation we'll have on another day. I think we're, kind of time limited here, and that's a lot of
Right.
material.
Yes.
Well, let's kind of shift gears and talk about selecting a Medicare plan. Talk about picking out an MA plan. What are the three most important things? If you just said three things you absolutely need to lock in on before you pull the trigger on one of those MA plans, what would those be?
So, what I always tell people when I speak to them is you want to look at your providers. So, are your doctors in the network? Okay. Are your pharmacy, find your drugs and make sure that can you choose mail order or a 90-day supply. Okay. So, get your list together of your medications and then plan value. Are you getting extra benefits to help keep you well? So those are the three most important things that you really need to make sure is in the plan that you're looking at.
Great. So if I'm shopping for an MA plan, the company offering the plan should give me some kind of an access or a tool where I can drill in there and see, here are my doctors that I see every day. They're definitely covered by the plan. I can see which hospitals are covered by the plan. I can check and see which prescription drugs I'm already on and make sure they're covered, and maybe even see what the copays are ahead of time. Is that possible as well?
Yes, that is. And I always tell everybody, before you speak to an agent, because your friends are probably recommending different plans, that fit best for them. And that's great. I mean, they may have been in a plan for a long time, but not every plan for your friends or your family might work best for you. So it's good to talk to an agent. That's what I always tell people. So, yes.
Great. Well,
Yeah.
while we're talking about the kind of information that you need to
Right.
make sure that you select the right plan, why don't we talk a little bit about protecting ourselves
Okay.
from that fraud that we mentioned earlier that's kind of showing up now that's making us very unhappy?
Right. So, I highly believe in this because it's very scary. And 1 in 10 Americans over 60 can become the victim of fraud each year. And there's a significant increase in scams targeting Medicare beneficiaries during AEP, and that's through the National Council on Aging. So there's some things that not just seniors, everyone needs to really watch for. So they need to be careful that there are phone calls that people can call, they can call and you can pick it up. And they may say they're from Medicare or the federal government and ask you to verify your information. Hang up the phone. You do not have to answer any information. Do not give out your social security number. Do not. Never give out any personal information at all to them. Just because someone presents themselves as being trusted, you do not have to trust them. So hang up that phone. An agent who uses misleading or high pressure sales tactics to try to get you enrolled, if they're on the phone or they're at your house, you can ask them to leave. You can always ask a family member, a friend, to be at the appointment with you. That way you can feel more comfortable, okay? Or someone who calls you and you're not already on a plan, then to protect your personal information, don't share any information with them at all. Also, call the number on the back of your card. You can call member services. So you do that, you are more than welcome to do that. So always, I always say I have a gut feeling. So you always use your gut. If you're scared, don't answer the questions because you don't want to give that information out.
That's good advice. I mean, we all have to rely at some point on our own instincts and common sense. And if
Right.
somebody's calling you, telling you something's drastically wrong, you don't necessarily have to believe them. You don't ever want to give out your social security number, your driver's license number, bank account information. Nobody in an MA plan is going to call you and ask for that stuff, right?
Right.
And you can always deal with an in-person agent when you're buying an MA plan. They're licensed by the state. They're regulated at the state level. The federal government even makes, as I understand it, the commissions that they get paid are exactly the same. No matter who you work for, the federal government specifies what the commission has to be. So there's not a lot of gaming going on. So if you're getting pressured by an agent to buy one plan over another, that really doesn't always make sense, does it?
Right. So I think we have a couple of questions, Mike, that are from Facebook.
Yep.
Okay.
I'm taking a look. There's an elaborate question here about the difference between what a retail pharmacist can do and what a Medicare plan sponsor can do. If you're okay, Jonathan Hill, I'm going to take that question offline because the answer to that is not going to be one sentence. It's going to be very
Yeah,
specific. Yeah.
exactly.
And it's going to involve the limits of federal regulation on Part D plans. So
Yes,
that's not
correct.
that's really, this is not the right venue for that. The second
Right.
one says, I have an Advantage plan, but still have to pay a copayment.
Correct.
Yes,
Yes,
right?
that is correct. So with an Advantage plan, some of them you will have a zero premium, but there are co-payments with an Advantage plan. That is correct. You do have co-payments with that, and every plan is different how they set up their co-payments. So that is correct. Yes.
So when I'm transitioning from my insurance at work into an MA plan, my work insurance had a premium, a deductible, a copay, co-insurance, and MA plans, there may be a zero premium option available, right? But
Right.
all the other stuff, the copays and the deductibles and the co-insurance, that all still applies, right? Like regular insurance.
Right. Yes, that is correct.
Great.
Because some of them you might go to the PCP and there might be a $0 for your PCP. The specialist might be a different part for the co-payments, things like that. So yes.
Okay, great. This is very helpful.
Yeah,
Why don't we move on to what we call the ABCDs of Medicare plans?
perfect.
And what we want to talk about a little bit there is the difference between all of the different offerings that the federal government gives us. So, what can you tell us about that? Yeah.
Okay. So, yeah, and it's kind of like we say the alphabet soup. So Part A and Part B, those are offered by the federal government. And with those, they're referred to as original Medicare, like we said, the OMO. Part A helps cover your inpatient hospital care, your skilled nursing care, your home health care, and your hospice care. Okay. Part B is going to help cover your doctor visits, your outpatient care, your home health care, durable medical equipment, and some preventative services. Part C is your Medicare Advantage, what we were talking about. So that's Part A and Part B. And you have to pay your Part B. You get Part A automatically, but you have to pay your Part B to keep your Medicare Advantage or Medicare Supplement. And it also includes extra benefits. So you can get vision, dental, hearing, usually prescription drug coverage. You might even get fitness. So that's nice. And it also is Part D, and it is offered through private insurance companies. Okay. So Part D, or prescription drugs, that helps cover your drug cost and is offered through private insurance companies.
So, it sounds like you're saying that if I'm buying Part C, Medicare Advantage, I could literally be getting everything rolled into one. A, B, and D, and the drugs as well is an option, right?
Right. It's like a comprehensive plan. So it makes it so much easier on you to have all of that. Yes.
Okay,
Right.
so how do I make sure that that I've got drug coverage? How do I make sure of that?
Okay. So when you're talking, like I say, when you talk to an agent, you would speak to them, and with most Medicare Advantage plans, they cover the prescription coverage. But when you talk to an agent, you would want to make sure that the companies that you're speaking with cover a Part D plan.
Okay, great.
Yes.
I've been talking for a while now about the transition from going from coverage at work to
Right.
going to coverage in the Medicare program. So,
Exactly.
what happens if I keep working and I become Medicare eligible? So, I turned 65, but I'm not ready to retire. I'm going to keep working. What happens then?
Okay, so if you don't sign up for Part D when you're first eligible, you might have to pay that late enrollment penalty, like we talked about a little bit earlier. And that's added to your monthly Part D premium, even if you have a premium that's zero. So, you would receive a letter and they would let you know. Now, if you're working when you become eligible for Medicare Advantage, then you should take out the Part A, like I was telling you, because you don't pay anything for that. And it doesn't have a premium. Either you or your spouse must be qualified for the wage earner, which means you're working for at least 10 years and you're getting Social Security taxes. So you would get that. And the decision to take Part B depends on if your employer is considered a large or a small group, and if your spouse employer, if they provide insurance. So, if you're smaller than 20 employees, Medicare will be the primary insurance, and you should enroll in Part B during your initial enrollment period. And if the employer has 20 or more employees, the employer insurance plan will be considered primary, and you can delay enrolling in the Part B until enrollment. But you definitely need to talk to your employer. That's what we always tell, right? Talk to your employer first. So you would want to do that.
Yep. So if you are about to turn 65, at some point ahead of that, I would say 6 to 9 months before your
Yes.
birthday, if you're going to keep working, you should be in consultation with your HR department, because every company can structure their benefits just a little bit differently, right? And give
That's
you an
right.
opportunity to maximize your benefit, to get the lowest cost and the best coverage you can get. Wouldn't that vary from employer to employer, really?
It does. That's right. And then, you may want to keep working. Some people want to work after 65.
Me.
Yeah, I mean, so I know several people, they want to keep working, they don't want to retire. So yeah, I would definitely talk to your employer before you make that decision. Yes.
Very good. Well,
Yeah.
the cool thing about all this to me is the government has gone to a great deal of trouble to create all of these plans and then create an opportunity for private insurance to come in and wrap around and simplify for the average Joe everything the government has built in the last 50 years and make it simpler and make it more affordable. And it's been thrilling for me to watch Blue Cross get engaged in this effort and to create these plans that are going to take care of people so that when they're working and they've got Blue Cross at work and they turn 65, boom, they can stay on their Blue Cross and they don't have to have this big scary transition, because it is, right? It's scary
Yes.
for people to go from private insurance to a government plan if you don't know the rules.
That's right. Well, and that's why I say it's good to call an agent, because they can help navigate you through all these mucky waters and it gets so confusing. So that's why I say, and the agents just, they're not going to charge you to speak with them. So that's why I say call an agent. It's
Yep. So
helpful.
that's a great advice. Let's review our phone number. If you want to talk to an agent,
Yes.
licensed agents who've been
Yes.
screened very carefully, area code, it's 833
Two.
219
Mhm.
7435, right there on the screen,
Yes. That's right.
833-219-7435. Or if you just want to go online and get smarter, you can go to MedicareOptions2021.com. I also believe bcbsla/medicare.com is still alive as well. And that's
Yeah,
another really good website that you can use for information. Um,
exactly.
let's see, we're just about out of time here. I don't see any new questions in our queue that we would have to deal with. How about some parting shots, Ann, of what you would advise people if, when one of your relatives calls you on the phone and says, "Oh my God, what do I do with this Medicare stuff?" What do you really want them to zero in on?
So the 3 Ps, like we say, that is extremely important. Make a list of your providers. So your doctors that are network, the pharmacy. So your prescription drugs, get a list of your drugs that are together. For the pharmacy that you go to, write a list of your medications. Then the plan value. What are some of the extra benefits that the plan covers to keep you well? So there are a lot of things that we can help you out with. So give us a call, because you have less than a month to make a decision, and that's not that much time. And I know there's some questions in there, but we will make sure we answer them for you
Yep.
after the live stream.
We'll
And we
definitely, yeah,
we
we'll definitely go
appreciate you
back
all
and,
joining us today. So
yep,
yes.
we'll definitely go back and deal with every question
Yes.
before the day's out. Let me go ahead and thank everyone for joining us this morning, especially you, Ann. You've been brilliant, and we needed someone who's been doing this a while, who understands the nuances of Medicare to help us out. I want to let you know we have lots of videos here on our Facebook channel with member testimonials and expert advice from medical directors to kind of let you know what we can offer to you when you're shopping for a Medicare Advantage plan. If we're going to have more broadcasts, it'll be here on our Facebook site. You'll be able to see any new schedules. On November 11th, just 2 days from now, our dietitians, for example, are going to host an episode called Romaine Calm and Carrot On, which is hard for me to say because I'm such a bad vegetable eater. I had COVID and I lost my taste and smell, and my wife recommended I immediately start eating more broccoli because I couldn't taste it, right? So that's kind of the way it is at my house. But we can all do better with our holiday eating. Remain calm and carry on is one way to get that done. I want to go ahead and thank you again, Ann, for being with us here today.
Thank
And remember, we're just so proud to be part of an organization that has existed in Louisiana with the trust of the entire state since 1934. I was thinking about that. I visited my dad. He's 82. Blue Cross is 4 years older than he is, right?
you.
So the good citizens of Louisiana have been so good, kind to Blue Cross. We've tried really hard to be the kind of company they can count on and depend on, and we're just thrilled to be here. So let me let all of you go. I want to remind you 833-219-7435 or MedicareOptions2021.com. And thanks again, Ann. We're going to wrap up. I'm Mike Berto, healthcare economist for Blue Cross and Blue Shield of Louisiana. Good luck shopping with your Medicare products. And remember, you're not alone. Have a great day, everyone. And thanks for joining us.
Thank you.